Thank you so much, Susie. Good afternoon, everybody. My name is Angela Kara, and I am National Representative for Moldova of Safeguarding Support Hub, hosted by Terdezo Moldova. Next slide, please. As Susie mentioned, this session aims to present Ukraine refugee situation in Moldova and to highlight the key safeguarding challenges and opportunities. Next slide, please. Dear participants, first of all, I would like to mention that children and families from Ukraine have been welcomed in Moldova by Moldovan citizens, civil society, volunteers, and authorities who have given them access to safety. Since the 24th of February 2022, the Republic of Moldova has received over 695,997 refugees. It's important to mention that nearly 95,856 refugees currently remain in Moldova. The government of Moldova has accomplished considerable achievements in providing protection and assistance to refugees. A crisis management center was established by the government of Moldova in cooperation with the UN agencies to coordinate the refugee response. Next slide, please. Working groups were set up in order to respond to the needs of Ukrainian refugees in protection, education, health, accommodation and transportation, inclusion, other important areas. Next slide, please. The PSEA network, the main forum on safeguarding, and over 1,400 international and national staff working to support both development and humanitarian activities in Moldova. It's important to mention that over 14 Moldovan NGOs, members of the task force, have jointly provided support to many refugees from Ukraine. Next slide, please. Dear participants, in order to highlight the key challenges and safeguarding risks, I would like to share with you the key findings of the rapid needs assessments conducted by international and national organizations. So the rapid needs assessment conducted by Resource and Support Hub has highlighted that 85% of people staying in the country are women, elderly persons, and children. At the same time, 60% of women reported to be traveling alone. 83% of women met in transit locations were traveling with at least one child below 18 years of age. 1 in 5 refugees have a chronic disease, are disabilities, are wounded, or pregnant. Next slide, please. Given the demographic profile of the refugees, there are increased safeguarding risks for women and girls. So the assessment conducted by UN Agency Safety Audit Report has highlighted the risk of trafficking of women and girls to other European countries for the purpose of sexual exploitation. Specific concerns were raised in relation to private and hosting accommodation of refugee women and girls living in host community areas and in relation to private transportation at the border. Special concerns were raised regarding LGBT and refugees in access to protection and humanitarian assistance. The assessment drew attention to the lack of awareness of available services and lack of trust in the capacity of services to provide quality support that meet refugee needs. Next slide, please. In terms of child protection risks, Moldova Refugee Child Protection Report highlighted the risk of violence and abuse and exploitation, including child labor and physical discipline. Special concerns were raised in relation to accompanied and separated children. it is estimated that about 2% of children from Ukraine are accompanied and separated from their family. That cause psychosocial distress because of displacement and separation from family. A specific situation arise in relation to children with disabilities and Roma children who require special support in the process of inclusion in the mainstream schools. Next slide, please. Safeguarding risks for persons with disabilities are associated with sexual abuse, human trafficking, abuse and neglect, violence, lack of access to safety and recovery support. It's important to mention that accommodation and access to health care for persons with severe disabilities remains a challenge. Assessment conducted by Keystone Moldova that has been leading the task force on disability has shown the need to be more proactive in providing care and to identifying safeguarding strategies in supporting children and persons with disabilities. Next slide, please. This slide highlights the safeguarding risks for older persons. According to the assessment conducted by Health Aid International, the top of 4 disabilities older refugees faced were vision loss, working difficulties, hearing loss, and difficulties remembering and concentrating. According to the assessment, 82% of older people had at least one health condition, with 51% having more than one. 10% of those interviewed are traveling alone. This group faces risks and their support needs may be higher. At the same time, 62% of older people reported that they are traveling with children. This means that older person will play a crucial role in providing support to children. Next slide, please. The Roma population is another vulnerable group facing many obstacles like segregation, discrimination, and exclusion. The Roma refugee in Moldova report draw attention that Roma need more access to education and other basic services like medication and food, as well providing legal counseling in documentation for children and adults. Next slide, please. In terms of safeguarding challenges and opportunities in Moldova, I would like to highlight the following: lack of materials in Romanian language, unfamiliarity with safeguarding concept, and sometimes a misunderstanding of safeguarding concept. At the same time, during our discussions with a representative of a civil society organization, also highlighted the need for additional resources to scale up safeguarding support. In terms of opportunities, I'd like first of all to mention that the referral mechanism for violence prevention is still implemented in all regions of Moldova. At the same time, during our discussions with civil society organization from Moldova, it was highlighted the need to develop safeguarding guidance for different sectors. At the same time, to provide safeguarding training and mentoring support for all staff and volunteers supporting refugees. And last but not least, I would like to mention that the commitment of all stakeholders on one hand, and your experience and your interest in safeguarding the concept is an important step forward to transform challenges in opportunities and to ensure safety of refugee population in Moldova and to implement the safeguarding concept. Next slide, please. Dear participants, thank you so much for your attention. And with Thank you so much.